I think there's a couple realities that you have that your patients face and you face as it pertains to your patients right now. Pent-up demand isn't likely to exist. Patients, I think, are going to be pushing out and canceling their appointments. We have to ask ourselves if we're ready to practice what we've preached during this crucial time. Every dentist I've talked to for the last 10 years has told me that one of the marketable attributes for their practice is they take great care of their patients and they help their patient understand the oral systemic connection. And patients with gum disease are twice as likely to suffer heart disease, and 95% of Americans who have periodontal disease also have diabetes. And oh my gosh, I mean, oral bacteria has been found to cause stillbirth. All these connections and links with oral health has been all the rave for the last 10 or 15 years. Yet, I'm hearing from a lot of dentists that they're not going to open back up and continue to help their patients. And I see that as a little bit of a conflict of interest. Given, assuming, before you crucify me, let me tell you a little bit more. If we can overcome the PPE challenges, which we can, and we can open our practices back up in a safe way, and realize there's never going to be 100% certainty. Realize the purpose of flattening the curve was never to prevent everybody from getting infected. The principle of flatten the curve was saying everybody is going to be infected. And we're simply trying to spread the curve out so that we don't overwhelm the hospitals all at once. And this thing has morphed into, oh my gosh, we've got to quarantine not only the sick, but the healthy, which we've never done in the history of the world, by the way, because you may get the coronavirus. That was never the intention of the flatten the curve. And your obligation to your patients to continue helping them and improve their life and ensuring that their systemic inflammatory markers are low and keeping them healthy, in my opinion, is a significant obligation that you undertake. And you also are going to have patients that have emergencies, that have active decay and infections, and maybe you're doing emergencies, maybe you're not. Maybe you're sending those somewhere else. And putting off these routine procedures and this routine care is going to create more issues for your patients. I mean, this is going to create dental cripples. I talked about deep disability dentistry many years ago when we first started working with implant doctors and these patients that were edentulous, and what do you need to do? And this is what this is going to create. Now, we talked earlier about the three parts of the practice, the people, and the patients. I want to dive in and talk about the specific strategies around each of these. Are you guys okay with that? Are you okay if I move forward and really get into some of these specific strategies? Do you have questions now? Raise your hand if you want to move forward. Drop a question in if you want to ask a question here at this point.